Welcome, health enthusiasts. We delve today into an important health topic, the early signs of a fatty liver. This condition occurs when excess fat builds up in your liver, potentially leading to serious health complications. Spotting it early can make a world of difference. Why, you ask? Because early detection allows for preventative measures and treatment, thus reducing the risk of further liver damage. To stay ahead of the game, we bring to you the 10 early signs of a fatty liver. Sign number 1, unexplained fatigue. If you find yourself constantly tired, your liver might be working overtime. The liver is a powerhouse, performing countless essential functions in the body, but when it's burdened with excess fat, it struggles to keep up, leading to a feeling of constant tiredness. This isn't your run-of-the-mill end-of-the-day fatigue. It's a persistent, nagging exhaustion that doesn't improve with rest. Moving on to sign number 2, discomfort in the upper right abdomen. This is where your liver resides. When it's swollen due to fatty infiltration, it can cause a dull or sharp pain in this area. It's easy to dismiss this discomfort as just a minor annoyance, but it's your body's way of waving a red flag. It's signaling that your liver is under stress and needs attention. Then we have sign number 3, sudden weight loss. Now you might be thinking, isn't weight loss a good thing? In most cases, yes. But when it's sudden and unexplained, it's a cause for concern. This isn't the result of a new diet or increased exercise. It's an involuntary reduction in body weight that might be linked to a fatty liver. When your liver is not functioning effectively due to fat accumulation, it can disrupt your body's normal metabolic processes, leading to weight loss. So, let's recap. Constant unexplained fatigue, discomfort in your upper right abdomen, and sudden unexplained weight loss. Together, these symptoms form a triad of warning signs that your liver may be in distress. Of course, individually, these signs could be attributed to various other conditions. But when they occur together, they start painting a picture that points towards a fatty liver. While these signs might seem common, they could be early indicators of a fatty liver. If you're experiencing any of these symptoms, don't ignore them. It's important to consult with a healthcare professional who can provide a proper diagnosis. Remember, early detection is key in managing and reversing fatty liver disease. Moving on to sign number 4, jaundice. This is when your skin and the whites of your eyes turn yellow. Now you might be thinking, well, that's quite obvious, isn't it? And yes, you're right. But you'd be surprised how often this clear sign is brushed off as a bad case of the flu or a result of poor sleep. Jaundice is actually a symptom of many liver diseases, including fatty liver. It's caused by the buildup of a substance called bilirubin in the blood. When your liver is healthy, it breaks down bilirubin so it can be removed from the body. But when the liver is fatty, it struggles to do this, leading to jaundice. Sign number 5 is itchy skin. Now, this doesn't mean the occasional itch we all experience. We're talking about persistent, unexplained itching that just won't go away. This is because a fatty liver can cause changes in the skin that lead to itching. But remember, itchy skin is also a common symptom of many other conditions, so don't jump to conclusions. If you're experiencing persistent itchy skin, it's best to see a doctor to figure out the cause. Lastly, sign number 6 is an enlarged liver, also known as hepatomegaly. This may not be something you can identify yourself, but it's often detected during a routine physical exam. An enlarged liver may feel like a mass or lump on the right side of your abdomen. If your doctor detects this during an exam, they'll likely order more tests to determine the cause. These signs might be more noticeable, but they are often overlooked. Don't ignore them. Remember, early detection is crucial when it comes to managing and reversing fatty liver disease. In our next scene, we'll discuss the final 4 signs, which are often more severe and indicate that the disease has progressed, so stay tuned. Sign number 7, dark urine. If your urine is a dark color, it might be due to a fatty liver. Now, this isn't your typical morning after coffee dark urine. We're talking about a consistent deep dark color that doesn't lighten even with increased water intake. This happens because the liver starts to struggle with bilirubin, a byproduct of old red blood cells, leading to its increased presence in the urine. Sign number 8 brings us to pale stools. If you notice your stool consistently lacking color, it's not just an oddity. It's a cause for concern. The liver produces bile, which gives stool its natural brown color. A fatty liver may struggle to produce enough bile, resulting in a pale or clay-colored stool. Moving on to sign number 9, a loss of appetite. A fatty liver can interfere with your digestion, making you feel full or nauseous. If you're losing weight without trying or find yourself pushing away your favorite foods, it might not be just a phase. It could be your body's way of saying that your liver is under stress. Finally, sign number 10, a swollen abdomen. This is a sign you might physically feel. As the liver's condition worsens, it may cause fluid to build up in the abdomen, leading to a condition called ascites. This can make your abdomen feel bloated or swollen. It's not just about aesthetics here, folks. It's about your health. Remember, your body is a finely tuned machine, and it communicates with you through signs like these. It's crucial to pay attention to these signals and not dismiss them as mere inconveniences. These are signs you cannot afford to ignore. Your liver is vital for your overall health. If you're experiencing any of these signs, it's imperative to seek medical advice. So there you have it, 10 early signs of a fatty liver. Let's quickly recap. We've navigated through the maze of symptoms that could point to a fatty liver. The early indications range from fatigue and weakness to abdominal discomfort and yellowing of the skin or eyes. We've also talked about unexplained weight loss, dark urine, and swelling in the legs and ankles. And we can't forget about the last two signs, mental confusion and a tendency to bruise easily. These signs are not to be taken lightly. They are your body's way of signaling that something may be off balance in your liver, and it's crucial to heed these warnings. Early detection can make a world of difference when it comes to managing and even reversing the condition. So, if you're experiencing any of these symptoms, it's important to consult a healthcare professional promptly. Now, the journey doesn't stop here. Sure, identifying the problem is the first step, but what follows is equally crucial. It's about understanding what you can do to help your liver regain its health. And that's exactly what we'll cover in our next video. In our next video, we'll explore foods that can help detox your liver. Don't miss it. Remember to subscribe for more health insights and updates. It's time to empower ourselves with knowledge and take control of our health. So, stay tuned and let's continue this journey together.